So I'm here today with Leslie. It's week 3. Leslie, hi, how are you?
Good, and you?
Good, thank you. So the course is going well. Last week we've been covering assessment, pre and post-op assessment. So this week we're going to move on to the pre-fitting phase, pre-fitting rehabilitation phase. And this has been the week that you've been overseeing. So first of all, Leslie, maybe you could just introduce yourselves to everyone, let everyone know who you are, and then we'll just talk a bit about this week.
Yes, I'm Leslie, and I work for the ICRC since 7 years. I've been in various contexts, like Afghanistan, Iraq, and the last posting was in West Africa, in Togo, where it was a regional position, so I was covering also Mali, Ivory Coast, and Benin. So yeah, for the week 3, so it will be about pre-fitting rehabilitation just after the acute phase. So for us, it's quite an important phase because it's true that in our context, where the ICRC work, often the patient, they arrive at the center and they didn't have any rehabilitation in the hospital. For various reasons, most of the time because of socio-economical reason, they don't have the money to have the therapy. So they often arrive and they have been, maybe it's delayed, so 2-3 months after the surgery. So it's an important phase because this is when really they start to be to receive the treatment, to be ready to have a prosthesis. And it's also challenging because often they're very in a hurry. They say, please, 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 give us the prosthesis. And often they don't really see why they have to do all these exercises before. And often it's also difficult for them because it takes time.
Great, that's great. So if people working on week 3, and as they go through the topics this week, what are some of the most important things that they should make sure that they have the knowledge of before moving on?
So I think one of the things which is quite important is to manage complications, so to prevent them, but also to prevent them to become worse if there is any already, with various techniques, and also to treat them if there is already this type of, for example, contractures or a problem like this. This is the first thing which is important. And then there is also a chapter which I found is also quite relevant, is the psychology of the amputee, because this can also interfere with the rehabilitation process. If someone is not well on that behalf, it might delay everything. So it's also important to know what are the different phases in the grieving process to identify where your patient stands exactly. And then there is also an important part on patient education. And this, I think, is central, how to advise your patient and client about hygiene and stomach care, etc. And then another chapter, sorry, I think is will be there will be a lot of information, is about equipment. And so then it's up to the participant to know how deep they want to go in the subject, because it's very vast, and especially I'm thinking about the wheelchairs. It can be it's quite a big subject. So, but there is a lot of resources they can read. But then it will be more than 4 hours for the week if they're interested in this topic.
Yeah, so we continue to recommend that you just, as the participants, you just make sure that you run through all the topics that we've presented, and then if you have more time or more interest, then move into the deeper resources for more reading. And just remember, you don't have to cover everything now, as long as you cover the bases. The links and all the resources will be here after the course ends, so you can always come back to them. Yeah, and the discussion forum is still going really, really well. So we hope that everyone continues to contribute to the discussions that we point you at, but also don't just answer those questions. Keep answering each other's questions in there as well, and discussing between yourselves. So yeah, so looking forward to week 3.
Yes.
Have you got any other messages for this week before we move on, Leslie?
Yeah, so I think it's quite important also to stay in the topic while answering in the discussion forum, because sometimes it. So try really to answer the question we are asking, and to exchange knowledge between each other.
Yeah, perfect. All right, so look forward to this week. Thank you, Leslie. Leslie, we'll talk to you again in week 5, which is your other week. So we look forward to talking to you then.
Yes.
Thank you.
Patrick.